is a brief webinar for our eQuits Pay for Improvement program, which presents to you the guidelines for documenting both smoking status and smoking cessation intervention, as well as tracking your quality measures in eClinicalWorks. Just a few definitions before we begin. A CDSS is a clinical decision support system. eClinicalWorks has quite a robust CDSS, which consists of alerts and data collection tools designed specifically to help providers at the point of contact with their patient to administer high quality and high priority care. Smart forms are data collection tools in ECW, basically templates that facilitate the recording of information by presenting questions that change or vary based on responses to previous questions within that smart form. Order sets are customizable templates in ECW that present on one screen in one place different treatments for a provider based on a patient's assessment, and these interventions include things like medications, labs, procedures, and other smart forms. Quality measures are basically built-in reports in ECW's registry that allow health centers to not only track a patient population, but also to track patterns in their provider behavior. And we'll see examples of all of these in the upcoming slides. The CDSS alerts in ECW can be found in the panel to the right of the patient's progress note under the CDSS tab. For this eQuits program, we are generally concerned with two of those CDSS alerts. The first is smoking status, which helps providers in collecting data from patients regarding their smoking behavior. And the second is the smoking cessation intervention alert. Now this second alert is only triggered after the smoking status has been assessed. And the smoking cessation intervention alert facilitates treatments like medication, counseling, or fax to quit. To activate the smoking status alert, you simply click on the plus box next to the word smoking status and then on the smart form icon that appears underneath. This will take you to the tobacco control smart form, which has been specifically designed to help providers collect data related to their patients' smoking habits. If the patient identifies as a former smoker or never smoker, then you simply answer the follow-up questions and save the smart form. For this patient, you will receive no more CDSS alerts of either kind for the next 12 months. If, however, the patient identifies as a current smoker, you will be asked a series of different questions about that patient's smoking habits. The last question, are you interested in quitting? The answer to that question will determine your next course of action, and we will look at some of the variables here. After you answer those questions in that smart form, you simply click Save. Once you have saved that smart form, you can see that in the social history section of the progress note, that information that you entered is recorded as structured data. And you can see that here. To that "Are you interested in quitting?" question, if the patient answers thinking about quitting or not ready to quit, you will be presented with the smoking cessation intervention CDSS alert once you save the smart form. To activate that alert, you again click on the plus box, and then this time you will see an OS icon. By clicking on this OS icon, that facilitates the ordering of the appropriate intervention by bringing you to this order set. Here in this order set, you see a series of medications as well as procedures and the fax to quit smart form for which you can order any of these from this order set. To do that, you simply click on a box next to the intervention you like to order, and then click on the order button at the top of the order set. Once you do that, that order will be stored as structured data again within the patient's progress note. So here you can see in our example, we ordered Chantix, and then in the progress note, you can see start Chantix has been recorded. And this will suppress the alert for 12 months, and again, will be counted towards your quality measures. If the patient had answered ready to quit for "Are you interested in quitting?", the process is a little bit different. You'll be presented with a fax to quit referral form automatically. What we are recommending for this program is that you click on Close on that fax to quit referral form without saving or faxing it, and then clicking Yes when it asks, "Are you sure you want to close it?" The reason we are suggesting that you close it without saving it is that some future versions of ECW have eliminated this automated pop-up, so we wanted providers to get into the habit of using the order set to order the interventions rather than ordering them directly from the pop-up. So once you close that fax to quit smart form without saving it, you'll be presented again with that smoking cessation intervention alert the way you were earlier. So again, same procedure, you click on the OS icon and that will take you to the order set to record your intervention. So those are the two CDSS alerts and how you use them to facilitate both recording of the information as well as the ordering of the treatment. Now if we look at some of the quality measures, you can see how that, once that data has been recorded, how you can see it. So there are basically two built-in quality measures in ECW, one for each of those CDSS alerts that we saw earlier. To get to the quality measures, you go on the left side panel under the registry band and click on quality measures. The first, again, is smoking status, and you can see that under measure name. The second is smoking cessation intervention. And these are quality measures or reports that are on ECW. It's important to note that on the right-hand side of those quality measures, under the quality measure reports, you can see a description of what those reports actually are and how they're being calculated. So to run one of these quality measures, you simply choose a report end date and begin date, and then click the Submit button. For the smoking status measure, what this quality measure consists of is in the denominator, it's the number of unique patients who have visited your practice, and the numerator is the number of patients of those who've had their smoking status identified. So in this example, we see 5 patients have visited your practice and 3 of them have had their smoking status identified. To get more information about these patients, you can use the crosstabs. So in this example here, we are using PCG, which is primary caregiver, clicking on that and then clicking on the Refine button. That will break down those 5 patients in terms of who is noted to be their PCG. And this helps you to track patients as well as provider behavior. For the smoking cessation intervention, you can simply change the measure name, enter an end date and a begin date, and click Submit again. This measure will generate, in the denominator, is the number of patients who've had a smoking status of current smoker, basically the smokers that you've identified, and then the numerator is the number of patients of those who have received a cessation intervention, either a medication or a smoking counseling intervention or the fax to quit. So that's how you document an ECW for smoking status and smoking cessation intervention, and that is how you track your behavior using the quality measures. So if you have any questions, thank you so much for participating in our eQuits program, and feel free to contact me, Danny Reichert, at dreichert@health.nyc.gov.